So, welcome to another beautiful day. We are about to speak into quite a number of topics, a number of things. I want you to just some very interesting topics here. So, as a matter of fact, I intend to do this. I've mentioned quite a number of times that when you sit in the consulting room, you tend to see a number of people who are suffering from what we call cancer. Okay, it could be any form of cancer, it could just be any form of cancer. But in today, I'll be coming your way with a book that I have personally written. I've written a book about cancer, and the purpose of the book is not to treat cancer, because the treatment of cancer is really, really difficult. There are different types of cancers, and there are different forms of management protocols that people actually needs to get themselves involved in order to get these cancers treated. In today's live video, I want us to explore the five main things that causes cancer to appear in any person at all. In any person at all. It could be me, it could be you, it could be someone related to you. So we are going to talk about the basic mechanism that makes cancer okay. And I'm going to show you how these mechanisms we are going to propel above the mechanisms using food, using functional medicine, using simple foods that are available to you. They are within your circle. These foods are within your circle, but it's really difficult. So what I'm going to do now is, from this period of time until the book is released, I'm going to talk or constantly talk about these things. I'll be taking chapters from the book, so that we discuss them, we talk about them, we help people understand why they need to put some of these foods, even in their toxic foods, in whatever we are taking. There's a bit of toxicity in there. So we are going to talk about these things and be able to explore other measures. Does that make sense? I want us to talk about them. We will try our possible best to as well get the right kinds of foods, some of them the proportion, because cancer is a very toxic thing that doesn't affect just an individual. When it's affecting you, it's affecting your children around you, it's affecting family members around you, because they need to imagine going to work, and at work you need to leave work just to sometimes cook certain kinds of foods, go and give them to your friends, go and give them to your family members, go I mean, just to go and make them feel comfortable. To everyone who have joined me here, I want to salute, greetings to everyone. I thank you for joining me. We are talking about cancer, and I have a functional therapy, or something that a lot of people will benefit from. These are foods that we buy them around us. These are things that we find them on daily basis. We eat them, we use some on our skin, and etc. So in this video, we will be going a little bit into it, just to be able to help each and everyone, to calm the nerves of people around us. If you have a family member who has cancer, if you have any relative at all, if you yourself you are battling cancer, this book is for you. Also, I'll be talking about when you are taking cancer treatment. Okay, when you are on cancer treatment, cancer management, what you need to do, because when you are receiving chemotherapy, radiotherapy, and etc., there are a lot of side effects that come as a result of these therapies. I want to say that today I'll tell you guys something. Today I was on a cancer ward, and if you're in the UK, you'd realize when you hear the name Macmillan, it's actually telling you it's a cancer ward. If you're in the hospital and they tell you Macmillan ward or something like that, you understand you are on a cancer ward, right? Yes. So on the ward, I found out, I went to one of the consultants because I've heard quite a number of things about this medication, vitamin D3. I've heard a lot. I have a friend who also deals with a lot of this vitamin D3, but I wanted to actually find out from the consultant's perspective. No, please, I'm not. Carlos, I'm not. So I wanted to find out from these consultants what at all does the vitamin D3 do to cancer patients? What does vitamin D3 do to cancer patients, or what we call the cholecalciferol? What does it do to cancer patients, and why do they even put patients who are undergoing some of these treatments on vitamin D3? If you find this video very encouraging, very good, you can like, you can share, put down your comment, and if there is anything, I will answer you straightforward. Okay, so let's get into it. So there are actually 4 mechanisms of cancer. Actually, there's sometimes 5 because of tumor environment. So there are 4 mechanisms, main mechanisms, that every kind of cancer follows. Every kind of cancer you know of, it follows this particular mechanism or pathophysiology, or how the cancer occurs. And in these mechanisms, I will be walking you through them. And after each mechanism, I will let you understand, or I'll let you know that these medications are, or these foods and nutrients are what you need to stop or block whichever the cancer cells or the tumor cells are, and how we can actually help ourselves. Because the number of people who are battling cancer is sometimes mind blowing. For all you know, you as an individual watching me right now, I'm not saying that should happen, but you might be sitting on a time bomb, like a tumor cell or a cancer cell. It could be any type of tumor cell or cancer cell, which if you are not careful, if you are not able to get yourself tested the right time, the right way, and etc., if you are not careful, you might realize the tumor cells have gotten to the worst part, and that is what we want to prevent. And so let's go into it. So we have the entire document is going to cover cancer prevention and suppression. When I say prevention and suppression, I'm talking about bringing, so we want to prevent it. We don't want it to occur at all. We don't want the cancer cells to come in at all. And so how are we going to deal with that? And also, how are we going to suppress it? As in, how are we going to make sure that even though there are cancer cells in us, we need to do something to bring the cancer cells down, which means that the rate of progression of the cancer cells are being reduced, or we are bringing them absolutely down. And this is one of them. Number 2 is angiotensin inhibition, angiogenesis inhibition. Angiotensin is actually in some of the medications for hypertension, but that's not what I'm talking about. So angiogenesis is when the cancer cells are able to promote, or they are able to produce their own blood vessels. The reason why cancer cells are able to grow buoyantly, or they move anyhow they want, is because they have their own blood vessels. When they travel to one point, they are able to grow, their own blood vessels in order to help them feed the cancer cells. That is why when you as an individual, you have cancer cells, and your blood levels constantly reduces is because there's something we call accessory blood vessels. Now, these accessory blood vessels are vessels that have found their way, they've intercalated to the main blood vessels, directing it to the actual cancer or the tumor cells. And at this point, they are going to drain you. So you are always anemic. That is why in cancer patients, they are always telling them that you need to stay, your blood levels needs to come up. You need to get enough or adequate blood supply, or we need to get you more blood medications. Is that okay? So that is why we need to understand some of these things. So we are going to talk about that as well. We are also going, the third point is invasion and metastasis reduction. Now, this whole book I've written, or is going to come out soon, is going to help us. You see, the reason there are two main types of cancer. Now, the two main types, we have one that is local. It just stays at the particular organ. It just stays at that particular organ. So these organs, let's talk about it. Let's say there is a brain tumor. Now, the brain tumor, we are calling it a brain tumor because it hasn't spread to any other part of the brain, any other part of the body, but it's only stuck in the brain. Let's say there's a lipoma. Lipoma is a collection of fat tissue. Now, the fat tissue, let's say it's here. So you realize that over here, or this part of your body, is swollen. And it's swollen because the cancer cells have deposited just here. And so whatever you do, what you can do is even you can make an incision and remove the cancer cells and patch the part back. But when we talk about invasion, it's telling us about how the cancer cells are spreading into the skin tissues, into the blood, into different organs, into several parts of the body. And that is the most dangerous part of all the cancers. When the cancer metastasizes, immediately it metastasizes areas such as, imagine there is a cancer in the gut, in the stomach. Now, in the stomach, it tries its best. It colonizes the entire abdomen. So the stomach will get its own share. The intestines will get its own share. You know that the stomach is different from the intestines, right? Yeah, so there is the intestines and there's the stomach where the food goes to collect, and then it spread. The food then moves through the intestines. Then we get some in the rectum. Now, the food, the cancer tissues now in the gut spreads to areas such as what? We have the pancreas here, we have the spleen, we have the kidneys here, we have the, if you come down a bit, the appendage is there, and then it continues. Now, the sad part of metastatic cancers is that metastatic cancer will not only feed on the local environment, it then moves or it then spreads to areas such as the bones. Now look at the vertebral column, which lies right after the rectum, the colon. So starting from the coccyx, so all the way climbing up, and this bone, the entire vertebral column will have its fair share of the cancer cells. Now the other part is because blood is moving from one point to the other, it's going to enter into the blood vessels and then spread. Anywhere the blood goes, you can imagine there is going to be cancer cells in those areas. And that is what makes it so difficult when you are treating cancer cells. Now, this is the part we don't usually talk about. If we were talking about these things and you hear you have cancer, you will immediately run to get some life-saving interventions, and that is what is going to help each and every one. But these interventions, these are some of the things I'm going to talk about here. Now, the next one is immune evasion prevention. So this book will be talking about, you see, the immune system. one thing about our immune system is that anything that enters into our system, it tends to break. The body needs to form antibodies to break it down. But immediately cancer cells enter the body, if you have a very strong immune system, your body will begin to break some of it down. Now, in the process of breaking down, what is going to happen is the body antibodies or the body's immune system will then begin to fail because the cancer cells begin to produce quite a lot, and it's very rapid. The rapidness of the cancer cells is what will it will break down the entire body immune system. So the immune evasion, we are going to give some of these foods and other things that are going to help tame the immune system, very active, and then tame the cancer cells rather, because that is what we need to crash down in order to develop the body system. And then the last one is the tumor microenvironment modulation. I just talked about what we call the local and the metastatic cancer cells. Now, in every cancer cells, the cancer cells require certain things in order to grow. One of them is blood. The other is nutrients. The other is oxygen. That is why you hear that people are talking about oxygenation. People talk about oxygenation, deoxygenation. Why are we not going to add this to it? You see, there are nutrients that also comes involved. Okay, that is why I even mentioned the vitamin D3. So that point, when we get there, I will explain to you how the vitamin D actually have a massive effect on cancer patients. It actually helps treat a lot of cancer issues. But let's get into it. So this nutrition that I'm going to talk about is before the cancer, during the cancer, and after cancer treatment. There are people who have gone into remission. There are people who have they've gone to do chemotherapy, they've done radiotherapy, they are still undergoing it. They are having a lot. During the cancer treatment, people get a lot of side effects, complications, the pain, the hair loss, the muscle weakness, the malaise, lethargy, fatigue, anxiety, the depression, the things people are going through. And you know that it's not just you. You know the person who is having the cancer is not just that person, but rather it involves an entire home. You can imagine. Look at breast cancer. The reason why I did this whole thing was because of it was out of let me say experience. So I had a family member, I had a relative who, after just 2 years of having her child, just after 2 years, this child was actually breastfeeding. She was breastfeeding. She just started breastfeeding, and then the mother saw that one part of the breast, okay, has become tender. During that period, I was an intern. I was an intern in, that was 2020. Yes, that was 2020. I was an intern in a hospital. When I say intern, I was doing my 1 year clinical rotation after medical school. Okay, so it's a 6 years course. So I did my 5 years in school. I came back to Ghana to do my 1 year clinical internship. So whilst doing the internship, this lady, this family member told me that she had, it wasn't painful. There was no pain. Okay, there was no pain in her breast, just one. There wasn't any form of pain. So I told her, no, because you are not feeling any pain, I am scared. That was my first impression, because in most of the cancer cells, you should know that most cancer cells doesn't come with pain. Most cancer cells, they don't come with pain. And so you might be thinking this is just an addition to your body mass. This is just something to you and stuff like that. So I realized it wasn't good. And do you mean that the other breast you are breastfeeding is okay? She said, yes, there's no problem. When I breastfeed, there's no issue. I can see breast milk coming adequately and etc. At this point, I got scared because cancer can be unilateral or bilateral. It can be that there is cancer in both symmetries, or there's cancer in just one part of the body. So you can have cancer of just one side of your face, but the other side, there is no cancer. So immediately she told me it's unilateral. I panicked. I'm like, no, what is happening? And this was just, someone would say, back in the days, people who get cancer are people who are in their 50s, 60s, and etc. Right. But this lady was just 28, 29 years. This family member, she was just 28, 29 years. So I panicked. I'm like, what is happening? And then I told her we should go to the hospital the next morning. So it was during COVID. And that time it was really because I had a pass, because I was a medical doctor under training, and we were also seeing a lot of patients. So I had a pass. Back in Ghana, we were able to pass through the police stops and etc. because we were in lockdown. I took her and then we went to the hospital. So at the hospital, I called, she passed through the whole process of seeing a patient. And then the doctor said, let's go and I'll examine you. I had to be there because I was still a student. Let me say I was an intern, so I was still a student. I was still under training. Went with her, entered into the consulting room, had the breast examination done, and the doctor just turned to me and I saw the face. I knew the look. I knew the look of what was happening. And I panicked. Now it became worse. It became a pressing issue to me. I'm like, no, we don't want to hear this. We don't want to hear that. We don't want to. Okay, so we did we went through, I'm sorry guys, we went through everything. And then the doctor said, my senior colleague, he was a specialist, so he told me that what is happening, we might have to run some tests. The tests were tests that you had to go and take a chest x-ray, you do a CT scan, we do some blood tests as well. So this was the moment of truth. This was the moment of truth. I followed up. We went all the way to where we could get the scans and, everything done. It's not like you need to have money before you do all these things, but when you have money a little bit, you'll be able to fast track some of these things. When to do this, when to do that, when to do that.